Every time a woman comes into the OP seeking infertility treatment with her mother or mother-in-law, I always send her back and tell her to come back with her husband because infertility by itself is a couple issue and not a woman issue. Just because a woman bears children doesn't mean that the infertility is because of them. In fact, if you look at all the statistics, 50% of all infertility issues are because of the men. Hi everyone, welcome to another video. My name is Dr. Sarushat Badina. I'm a reproductive medicine specialist and today we're going to talk about male infertility. Unlike in women, men do not have a biological clock, which means that they can actually become a parent much later in their life. But however, chances are that the DNA in the sperm might have certain issues as the men keep getting older, and this is called as DNA fragmentation. I have made a complete video on this separately. If you have not checked it out, do click the link that pops out here. And on the other hand, I have also had couple who come to me who have only tried once for trying to conceive and they did not conceive, and they just have this surprised Pikachu face and they're like, doc, I've tried and I still didn't get pregnant. You need to understand every cycle a couple only has a 20% chance of pregnancy and not more. So coming to the topic in hand, I have divided male infertility into 4 different subtypes. The first one being there might be an anatomical issue in the penis itself, that is they might have a micro penis, and fortunately this constitutes only a very small portion of the male population. The second one being the man is unable to hold an erection, which is also known as the erectile dysfunction, anejaculation or retrograde ejaculation where there is no ejaculate through the penis, and finally the fourth one where there are changes in the sperm parameters. So before we start off with any treatment protocols, we would like to get some basic things out of the way. We would like to get a complete sexual history from the couple. We would also like to do a physical examination of the man to make sure all his anatomical structures are within normal range. We would also want to get a basic semen analysis out of the way because we want to know whether he has a good number of sperms, whether these sperms are actively motile, and whether they look normal or not. And of course, we also want to know certain hormonal parameters like the FSH, LH and testosterone, which are responsible for sperm generation. Coming to treatment, men who are having erectile dysfunction, what we have noticed is mostly it is anxiety based, and usually treatment for this takes somewhere between 4 to 6 months. However, patients who are coming to us for fertility issues, we would not want to wait for that long. So using treatments like electroejaculation or certain medication, we are able to retrieve a sperm sample from the male partner, and this sperm can be used for a process called as the IUI, also known as intrauterine insemination, where we process the sperm and directly put it into the uterine cavity on the day of ovulation. Now the same process of IUI can also help a lot of men who are having anatomical issues like the micropenis, and it can also sometimes help in men who are having anejaculation. So what do we do for men who are having very low sperm count, that is the count being lesser than 10 million, which is very important for a successful IUI? We try to give them medications to improve the sperm count, but however, if there is absolutely no improvement, then we would subject the couple to an ICSI procedure. In this procedure, we retrieve all of the eggs outside, we retrieve the sperm, we take a single sperm, inject into each and every egg, we make the embryos outside, and once the embryos are ready, we go ahead and we transfer it back into the uterus. Now coming to men who have no sperm, also known as azoospermia, we retrieve the sperm directly from the testis provided all their hormone levels are within normal range, and this retrieved sperm will be used for the process of ICSI, which I have already described to you before. However, if the couple are a bit more young, we would ask them to do major lifestyle modifications, like if they were smoking, to stop smoking, and of course drinking, drugs, to avoid them as much as possible, making sure they eat healthy food, getting enough exercise in, and also being mindful. Also, performing specific pelvic floor exercises like the Kegels exercises for men are definitely very useful to improve the blood circulation in the genital area, and recently we have started using the Kegels chair to help the man perform 12,000 Kegels exercises within 20 minutes. And there's absolutely nothing wrong in taking supplements like testosterone boosters to help improve the testosterone levels in men, and this can also have a beneficial effect on the sperm parameters. And this is a universal fact. Heat by itself is detrimental to the sperm production, and even a 2-degree raise in the scrotal temperature can cause a lot of issues in the sperm parameters. We ask the men to stay away from saunas, hot tubs, keeping the laptops on their lap, and of course long bike rides. And recently a lot of studies have been done to show that the oxidative stress causes sperm DNA damage, and if such a sperm fertilizes the egg, then the chances are that the couple can suffer from recurrent miscarriages. So that is something to watch out for. That's it for my video. Thank you all so much for watching. I hope you got got some good information out of this. If you did, go ahead, leave a like on this video, and for more such information, do subscribe to my channel. Until the next one, guys, see you and have a great day.